heard earlier this week that it may be lifted mid-May. We don't know for sure. Then we would have 60 days to complete the regulatory approval process at the state level. We have yet to file at the federal level for approval. That would probably, we would file for that at the end of May. So we're not officially an organization yet, but we continue to work together, and fortunately we have worked together for a number of years already, so that's been quite helpful.
Great. I have a question about the testing. How many tests have been done in this area, in this region? And secondly, how long does it take now to get the results back for the tests?
So at Monadnock Community Hospital, we've tested around 550 people. And the test turnaround time has been sporadic. Sometimes it's a couple days, sometimes it's a few days. I think more recently it's been pretty good. I think we said yesterday we had about 40 test results waiting, but they seem to be coming back fairly quickly now.
How many people have tested positive of that 550 that you've tested?
I'd rather not talk about those kind of statistics. It's a small community, but I think on average, I think we're seeing less than 1% really of positives.
Okay.
Which is, it's a small number. I think as I look at our community, we've done a really super job. And I would just say even, you know, the facilities, the residential facilities have kept people in. And that's the kind of thing that has really helped all of us by being very vigilant about our integration with each other, as challenging as it is. The challenge may be as we open things back up again and we start to expose each other, we are worried that we'll see another surge. But what we're hearing from the clinical leaders, the CDC and so on, is that we think this will be with us for a couple of years. It might surge intermittently, it might stay low for a while, but until we have adequate antibody testing, which is just starting to come available now, we don't know the level of exposure in our community, and they're working on vaccines and those kinds of things. Many organizations nationally and internationally are working on a vaccine.
Where some of the national figures are supposing that the numbers may be artificially low on testing, you know, the cases and whatnot. Do you have a sense across the New Hampshire numbers, have the tests been a pretty good representative cross sample of people, or are they just people with symptoms, or just people feeling bad enough to show up at a medical facility, or how trustworthy is that number?
I've always had the sense that we probably, I think everyone is lower than I think the tests are not widely used right now. So if we tested everyone, we might have a different picture. As more tests become available, we may identify more positives. When we look at our demographic in New Hampshire, and there's a lot of modeling out there from, say, the University of Washington, the Mayo Clinic, Emory University. There's a number of medical schools that have put together some models based on your demographics of your community, your state, your level of like urban versus rural. And so when we looked at New Hampshire, I think overall we expected a pretty low rate because of our distance. Naturally, our whole state is mostly rural, and that's why I think you're seeing, you know, Salem and Rockingham have a little more activity. Nashua and Manchester have a little more activity. Our area, this other side of Hillsborough County, is very low rates right now. But I think overall the initial expectation was, I think, around 350 deaths in our state, which is pretty low when you think about other states that we're hearing about. And right now, I think at the state level, there have been about 66 deaths total. So the numbers are not as you're seeing in Boston or New York for sure. And of course, elderly folks with other health conditions are most at risk. But we do see some younger people developing it. They have better immune systems than most of the older folks do.
I have a sort of history question. I don't remember this ever happening in the past in my lifetime. Has there ever been a shutdown like this that's occurred that really then we recover from? What's the history of this? I've been in healthcare more than 35 years, and I have to say I've never seen anything like this. I think we've seen things on a much smaller scale, but I was reading one of the listservs that I get is just all the hospital news. I was reading about the flu of 1918. And if you look at any of the back news stories, I think there was one up in North Conway where, I mean, a very similar thing happened. We didn't have the hospital systems back then that we have today, number one, but it hit similarly. I mean, people didn't know that they infected each other and people died from that flu. And we've been expecting in healthcare another pandemic flu. And so I think this is that pandemic flu. I liken this process a little bit to HIV and AIDS when that came into being in hospitals. Certainly not to the level that we see this, but from a hospital perspective, we had to change our entire way of handling patients. We learned universal precautions. We gowned, gloved, and masked. And so we did all of these kind of infectious disease kinds of precautions. And so it reminds me of that process a little bit. This seems to be a little bit more virulent. People are well and you're walking around and you just don't even know you may be shedding the virus on your friends, neighbors, and children, and parents, and whatnot. And you feel fine. It is unprecedented. I mean, as far as hospitals closing down the level of operations that they have. I've never seen this kind of shutdown. Lots of creativity these days.
Certainly, we love hearing from you, and I love any voice with some authority to share things with us. Do you have any I don't know, personal read on the international scale of this? Anything that might be beyond our normal way of thinking about it or viewing it?
I probably have the same as you. I think that a lot of states, if you look at across the country, what you're seeing some have started to open up again. I think California, Oregon, and Washington State have sort of coalesced to work together about how they open up, and that makes a lot of sense as people are allowed to travel and those kinds of things. Connecticut, New York, New Jersey, I'm thinking Pennsylvania may also be working together about how they open up. It would be great for Maine, Vermont, New Hampshire, and Massachusetts to work together because we've already had a lot of folks travel, back and forth from Massachusetts. And so those are the kinds of things we're seeing that are helpful. I do think we have a lot more supplies and equipment than we've had, but I will tell you, our representatives in Washington, D.C. have been advocating for hospitals in our state and getting us supplies. Some of our local businesses had stockpiles of pallets, for example, in China and Japan that were not able to get out of the country. And so there's still a lot of that kind of thing that's occurring. Nationally, a lot of states are talking about opening up now. I think
we're just watching. We have to watch and see what's happening in locations that are doing that. I'm sure that's what the governor is focused on. But I don't have any real inside track. I mean, the CDC, the World Health Organization, many educational centers, Dartmouth, Mayo, the medical school centers are working on testing drugs and treatments and vaccines. And, hopefully we'll have some results in the near future.
Any thoughts? I think Rhode Island is probably the most interesting outlier in the neighborhood. About the same population as New Hampshire. Many more cases than we've had, but they've been doing a remarkably effective job of testing much higher levels than other states. And some of that gave them higher incidence on the number of cases because they knew, but they also started learning that the cases were pretty evenly distributed by age. It's just that most people who were younger didn't get caught in most people's testing web because they weren't that sick. And they're perhaps on a track to be able to open up more quickly with a wide-scale testing and tracing of contacts than the other states around here. Is that a useful thing for New Hampshire to look at and something that we might be able to model better or whatever?
Yeah.
And I suppose along those lines, did anybody, for instance, Manchester, hit enough of a surge to be close on capacity at any point in here, to your knowledge?
No one has hit the surge at this point in time. At any one time, we've had on average 4 or 5 patients that were suspected, but didn't turn out to be positive, and we haven't hit the surge that we thought. But none of the other hospitals have either. I think currently there's just a little over 100 patients hospitalized throughout the state. So we did stand up some additional beds in Keene at Keene State. I don't know if you were familiar with that, for our region, and Cheshire and that Community Hospital worked together and agreed that we would work to staff that in conjunction with Cheshire if we needed those beds, but we have not needed any additional beds at this point in time, and neither has any other hospital. Rockingham right now is probably surged a little bit, but they haven't had to transfer patients to other locations. And I would say, yes, we do look at states like Rhode Island, and we try to model, what they're doing, model it out for ourselves as well. There's a lot of data out there, many different approaches to this. When we look out, even over 18 months, we feel, at least in our region here, that we have a lot of capability to handle what may come. And I feel like the state feels the same way. When we get more testing, I think we will have a better understanding. And it has been slow in coming, there's no doubt about it.
I think it's worth mentioning we all know how special the Monadnock region is, and the level of cooperation that we've seen among groups is just been unbelievable. We have employees who have one staff member has a brother who's a physician down in Baltimore, and when they hear the stories about what's going on in our region, they can't believe that such a thing is going on. But for example, like the mask making effort, we've received over 6,000 of these sewn fabric masks, and people leave them at drop-off locations that are published, 5 local drop-off locations. And so many places in the country, those would just be stolen and sold. But, in our region, that just doesn't happen. And level of support of our business communities, and, getting a call from New Hampshire Ball Bearing that they have 1,000 N95 masks for us and 5,000 goggles. And it's just been incredible. and the level of support.
The maker space creating the, yeah.
Makerspace is making, Roy and his group are making these amazing shields for us. I know Bob McDonald has sent some information our way about 3D, what could be done. And James, I know you're involved with Makerspace. It's been incredible. We're really fortunate.
Actually, Laura, while you're on the floor, how many of the staff members have taken up the offers like McDowell Colony for people who were concerned about going home to, endanger their own families rather than getting a cottage over there?
At this time, we have, I think there are 4 staff members staying in McDowell and another one hoping to settle in there. So not as many as we had anticipated, but it's so good to know it's there. And for those 4 people, it's a godsend. The volunteer corps that we assembled, I'm not sure if I mentioned that before, but early on when we were expecting a surge at some point, we knew we were going to have reinforcements for our staff. And over 130 people signed up on our website and participated in the Google form to let us know what skills they had that they would bring to the table. But we haven't had to use those folks yet.
Amazing outpouring of support on every level.
You have all the tests kits that you need, Cindy. Are they easily obtained?
We get new supplies every day. I think if we had an unlimited supply, we'd probably do a much broader testing of people. We're kind of testing based on symptoms right now, unlike Rhode Island, I think more widely tested. And I will say also that there has been some question at times about the actual validity of some of the tests. I mean, we've had some negatives that we really felt were positive, those kinds of things. And so that's been a little bit disconcerting. But I think we get shipments of tests or kits every day. And there's an oral swab and there's a nasal swab. And I think the nasal swabs are a little more reliable than the oral. And I think our docs are beginning to test more widely now that they're more available. But we'd like to test all of our employees, for example, and we don't do that.
You would not?
We would test all of our employees, but we don't do that now. And we would test our patients before they come in for surgery or things like that if we were able to do that.
If you had enough tests, you would, as a matter of course, test all of your employees.
Mm-hmm.
But you just don't have enough test equipment available.
Not at this time. We expect that to get better. It gets better every day.
How many employees do you have?
We have about 525 employees.
Wow.
And that's about the number of people we've tested. And it's not employees that we've tested.
Yeah.
So, yeah.
Who is the gatekeeper on the tests? Where are they coming from, and who determines that Monadnock Community Hospital gets whatever number of tests?
They come through the state, and I'm not sure what their algorithm is, but I think there has not been a lot of them coming into the state. So as you look across the country, the hot spots, if you will, seem to get a lot of focus for testing and supplies and things like that, which is good. We're not a hot spot. I think that we will get to a point where this is a routine test that we can all access. And then every hospital does not process them. We have to send them through the state lab. And Dartmouth is doing some of that as well. They have applied and been approved to be a processing site for the tests. And CMC is also working on becoming a processing site. They have a phenomenal lab there. So right now, every hospital collects the specimens and they get couriered to the state lab in Concord or to Dartmouth. We did begin using Quest, which is a commercial lab, or LabCorp, which is also a commercial lab, and those are national labs. At first, those were quickly returned, but then everyone started using them and they became quickly overwhelmed as well. Again, I think this is improving every single day, and it's something that we check on daily.
I think, Rick, did you have another question?
I did, but I forgot it. No, I know what it was. I understand the state stay-at-home restriction is supposed to expire in May 7?
May 4th.
May 4? Do you anticipate that will be extended, Cindy?
I do anticipate that it will be extended. How I am hearing, as of late yesterday afternoon, some of my team was on a call with the Hospital Association, that there will be some restrictions lifted. So for example, they may allow hairdressers and barbers to open as long as you only have one customer at a time. They may consider outdoor eating areas to be open with appropriate distancing, but not regular restaurants. I think they're working through the details. So there may be some extension of the stay-at-home order, but maybe the essential businesses would be relieved a little bit in some way. It'll be an interesting test as we start to see some little bit more integration. Are we going to start to see more disease?
Do you think it's anticipated that Conval will open up in September, business as usual?
That's a good question. It would be nice. I have not heard specifically. I do know that the governor said for summer school that it has to continue to be done remotely, and that the school buildings are not going to open up over the summer.
Right. I heard this morning on the radio, the president of Brown University is saying her plan is to open definitely in September for business. And they're planning to do so.
Yeah.
Wow.
We take it day by day. I don't know the plan. I mean, there are states now that have opened up, and we're going to learn from their experience. So we'll see what that looks like. There's a committee that the governor has called the Reopening Committee, and he's talking with every constituent group to try to understand the impact and how it might function as we open up.
Back on testing availability, if an organization, say 300 people, wanted to test their entire employee rank, would that be possible today?
Not here, not in this state at this time.
Not in this state. Just because of lack of testing equipment.
Mm-hmm. Test, they're called kits. It's actually a swab and a medium, but the kind of solution that you put it in, and then the ability to process. You might have heard that there's some companies out there that are developing home testing kits. Those haven't really proven to be completely reliable at this time. And then Abbott Labs has a rapid test capability, and the equipment is there, the technology, but the actual kit that goes with it, the ability to put the swab in the solution, those are in very limited supply. So we have a new platform, a new product, but it's not widely accessible.
Thank you.
Mm-hmm.
In your opinion, what would it take on a national level to get enough testing done? What would it take?
I think you should be able to test freely the members of your community in groups if need be.
I know, but what kind of effort? I mean, would it mean a federal order that so-and-so companies have to be devoted to testing kits? I mean, is it an executive order? What would it take to get that volume of testing? Do you have any thoughts on that?
I think it would take something like that. I'm not sure that that isn't already happening, though, at the national level.
Yeah.
I don't know whether there's a specific order on that. There has been on ventilators. We have a lot of that supply now available. I think the labs are actively working on it. I don't know how easy it is to stand up another lab, for example. It's a little more complicated than producing a ventilator.
Yeah. It's more complicated to produce the testing than it is the ventilator.
I think so. I'm not a lab person, but there would be no reason in my mind why they wouldn't be. I don't have any sense though what the barriers are really.
Okay.
I have a question on the shelf life for the ventilators. So is there like a time that those can be sitting around and be used? So if this kind of reoccurs in the fall next year, the next couple of years, are those still,
Yeah.
that can be used if they're not used now?
Yes, you can. Those are mechanical equipment. You just have to do preventive maintenance and run them and make sure that they're functioning. And we do that routinely. Most organizations, hospitals have a preventive maintenance program by medical engineers that check the equipment on a regular basis. It's considered emergency type equipment, so you do have to maintain it. And we added some equipment early on, which we dug up out of our archives and got retested and functional and that kind of thing. So it's not something we use a lot at our hospital. We don't use that level of critical care usually, and we generally transfer to CMC, Dartmouth, or UMass if we need that. But we have used them.
From what I've read or seen, ventilation seems not to be a very successful technique, and I presume that's in major cities where they have a flood of victims in the hospital. 90% perhaps don't come off the ventilator successfully in one article and so on. Is that accurate?
I can't validate the number. We have had successful use of that for our patients, and they have recovered and gone home. So,
Might that be due to an earlier intervention, given that our services aren't under so much stress?
could be, absolutely. And one of the things we did early on was to sort of separate out our clinic areas, and any patients that had respiratory symptoms, we had them seen in a respiratory clinic setting where that's all we focused on. And so that group of clinicians became very familiar with what they were seeing. And that has allowed us to be proactive, I think. But it is helpful if you don't have a surge. I'm sure that is a challenge.
But given how this disease is spread, so much of it being asymptomatic, without community-based testing on a frequent basis, are we able to actually drive this back? I mean, as we re-enter a more open society.
Are we able to drive it back? I think if we're all very cautious about how we re-enter, if you will, we should be fine. We will probably continue to see some exposures, but the goal would be to do that slowly and methodically. It is not yet fully known that when you have had exposure and you've been sick, whether you develop enough immunity to prevent you from having another recurrence. And so that is also a concern, that you may have been exposed, you may be fine, but that doesn't mean that you may not get it again. There are so many unknowns to this illness right now. Very scary for folks, I think.
Yeah.
Scary for our staff, scary for our clinicians, scary for all of you.
But you know the criteria, right? For your symptoms. Wash your hands frequently. Stay a safe distance apart. Stay home if you can. No hugging, much as we like to do that.
One of the things that surprises me in terms of my lifetime, I don't remember ever getting shut down in terms of schools and restaurants and so on by flu. So now, why is flu okay, but this is not?
I hear you. I mean, other kinds of organizations have shut down with flu and viruses, and I'm referring mostly to residential facilities, nursing homes, long-term care, assisted living. If there is a virus, they do shut down sometimes because of the level of contagion. Excuse me. But no, if there were a pandemic flu, much as there was in 1918, this kind of approach would be taken today, I'm sure.
Cindy, I don't know what the numbers are now, but I've heard that this virus is 10 times more contagious than a typical flu. Maybe that's to answer your question, James, on why.
That does answer my question.
I haven't heard that. That's pretty significant. I mean, flu shots, people should get their flu shots. That might be a help here. It is some form of a similarity to flu, but we're not sure yet what the virus is, I think, in the health industry.
I have a question that's come up among my swimming group that we swim in, Harrisville Pond, and one of the members is asked whether or not the virus can live in fresh water.
Have you heard, Laura? I have not heard.
No, I have not.
I don't know the answer to that. There was some early speculation that a warming trend might kill the virus. I'm not sure how that would work since all across the world, people in warm climates and cold climates seem to have had the virus. So I'm not sure whether if we had beautiful 80-degree weather or 70-degree weather, we'd have less exposure. I just don't know.
The virus doesn't like warmth, so maybe, Peg, if you could get the Harrisville to heat the pond, maybe to a comfortable 93 degrees. That probably
We'll work on it. We'll work on it. Yeah, we got a pond association. We'll see what we can do.
Well, I'm sure we could just keep thinking of questions while we've got the chance to get some answers. But we are at my usual little after 8:30 that I usually used to try to let people get on to their day and get on to work or whatever. I could stay here as long as you're available, but I'll just say if anybody is not watching the clock, I've got 8:34 at the moment. And I would say if you do have something else, just sort of give a little wave and click the button on the right and whatever. But and I'm sure, Cindy, you've got other things scheduled for the day. So first, I want to at least take a moment to thank you very much for joining us and especially for sharing your level of expertise with us. I would normally give you a decadent box of chocolates.
Oh.
I may have to just owe that to you because at the moment, all of our stockpile is locked away at Scott Farrar and I can't go in the door anyway.
Thank you.
But when we're allowed, I will try to remember to deliver your speaker gift, and thank you so much.
Thank you. And thank you all for inviting us today and for the opportunity to chat. If you have any other thoughts or questions, just contact Laura, send us an email. We'll try to get back to you with whatever information we can provide.
Thank you, Laura, and thank you, Cindy.
Thank you.
Thank you very much.
Thanks, Laura and Cindy.
So I guess officially we should close the meeting in our usual fashion, minus the bell. As a reminder, next Tuesday morning, we can do a virtual bird watching that Delcy tried to do in person this week. and I'll be putting out a absentee ballot type vote on things, and we'll at least meet if there's any discussion of that a week from today on Zoom, and we'll try to collect all those responses by then. So if nobody else has any notices, whatever, close in the usual fashion. Service.
Close out, profits, most, test.
And thank you all, and especially Cindy and Laura. You guys are fabulous, and we're really appreciative of your presence in our community.
Thank you, Cindy. Thanks, everybody. Good to see you. Stay well.
Have a good day.
Nice to see you all.